Are you one of our patients or followers who's using this medication, aspirin? This is Dr. Mike. Welcome to our Health Talk by Doc Mike. And have a good day, everyone, to all the viewers, to all the followers. And this is Dr. Mike based in Hong Kong. And if you're new here, don't forget to like, share, and subscribe this episode. We'll discuss the uses and side effects of aspirin. This medication is a non-steroidal anti-inflammatory drug, or what we call NSAID. So before we move forward to our discussion, please do watch this. Yes, good evening, everyone. This is Dr. Mike based in Hong Kong. Good evening to all the viewers. Good evening to all the followers. And if you're new here, I'm Dr. Mike based in Hong Kong. And if you missed our previous episode, you can always go back, check our library, different health topics, health education, health promotion, and health awareness. So you can watch all those different videos. But anyway, as I have promised, this episode is for our patient, for our clients who are using this drug, aspirin. My question is, are you one of them? Are you using this medication or totally unaware what is this medication all about? Okay, this medication is a non-steroidal anti-inflammatory or NSAID. I think I remember this medication because when I was young, when I had a fever, my parents will always give me this drug, aspirin. So for tonight, let me discuss this medication for all of you. What is aspirin and what are the uses and the side effects of this medication? And again, to all the viewers watching, if you have questions, feel free. You can chat us in the chat box. And we'll try to answer your questions. So, anyway, we move forward. Topic is all about aspirin, the uses and side effects of this medication. And did you know that this drug is a common medication for relieving minor aches and pains and some fevers? Because as I have mentioned, this medication is a non-steroidal anti-inflammatory medication. And there are times people would always use this as an anti-inflammatory or a blood thinner. People can buy aspirin over the counter without any prescription. So everyday uses include relieving headache, reducing swelling, and reducing a fever. So that's the main use of this medication. However, okay, aspirin contains salicylate, a compound found in plants such as the willow tree and myrtle. Way back in 4,000 years ago, has been recorded, this medication has been used previously. Okay, and this medication is taken daily, and aspirin can lower the risk of cardiovascular events such as heart attack or stroke in people with high risk. And sometimes doctors may administer aspirin immediately after a heart attack or prevent further clots and heart tissue death. So this medication, it's not just an anti-inflammatory, a blood thinner, but also NSAID. So I think some of our viewers might be interested about this medication in particular. Anyway, moving forward to our discussion about the uses of this drug. Okay, the main uses of this drug, aspirin, is for pain and swelling. Okay, if you are experiencing with headaches, flu or cold, sprains and strains, menstrual cramps, long-term condition, particularly if you have arthritis or migraine, so you can use this drug. As I have mentioned, this medication can be bought over the counter But again, you need to read the drug label. Moving forward, aside from the pain and swelling, this medication is also used in preventing cardiovascular events. The daily use of low dose aspirin can lower the risk of cardiovascular events in some people. So, however, it is not safe for everyone. Okay, so you need to visit your physician as well when you take this medication. As we have mentioned, this drug is used for cardiovascular events, and daily use of low dose aspirin can lower the risk of cardiovascular events in some people, but it is not safe for all. However, the Food and Drug Administration, or FDA, recommended that only using aspirin in this way under the supervision of your physician. Okay, remember this, under the supervision of your physician. And this medication is recommended in daily dose of aspirin for people who have the following conditions. If you have heart or blood vessel disease, okay, have evidence of poor blood flow to the brain, have high blood cholesterol, have high blood pressure or hypertension, have diabetes, or if a person is a smoker. However, for people without these issues, the risk of long-term aspirin use can outweigh the benefits. Moving on, based on the recommendation in 2016 from the United States Preventive Services Task Force, they recommended that adults aged 50 to 59 years old may take aspirin daily to prevent colorectal cancer, as well as cardiovascular or heart diseases. However, this guidance only applies to adults in the age range, okay, who have at least 10% 10-year risk of cardiovascular disease, do not have any high risk of bleeding, have a life expectancy of at least 10 years, and are willing to take a daily low dose for at least 10 years. So you need to remember this, dear viewers, dear followers, if you're watching tonight, that these are the recommendations if you are using this medication. Do not use this medication right away, but you need to visit your physician, okay? And you need to read the drug label. Doctors may administer this aspirin immediately. This is one of another uses of aspirin in treating coronary events. So if your patient experienced heart attack, stroke, or another cardiovascular event, to prevent further clot formation and cardiac tissue death. So we or doctors usually prescribe these medications after patients have had stroke or heart attack. So minimize the formation of further blood clot and cardiac tissue death. Okay? Moving on, aspirin can also be part of the treatment plan for people who have recently had particularly revascularization surgery, such as those individuals who have had angioplasty or coronary bypass surgery, patients who have mini stroke or transient ischemic attack, and ischemic stroke, which is caused by a blood clot. Okay. Another uses, because aspirin can also help treat pain and swelling associated with following chronic health conditions. Okay? If you are experiencing rheumatic conditions, including rheumatoid arthritis, osteoarthritis, and other inflammatory joint conditions, systemic lupus erythematosus, which I've discussed in past months, as well as arthritis. You can check our previous videos about arthritis and SLE. Inflammation around the heart, known as pericarditis. So doctors may recommend a low-dose aspirin also to people with retinal damage, also called retinopathy, who have had diabetes for more than 10 years, who are taking antihypertensive medications with a risk of colorectal cancer. So basically, those are the uses of aspirin. It's not only for pain and swelling, but also an anti-inflammatory medication because it's a salicylate anti-inflammatory, non-steroidal anti-inflammatory medication. And also, this drug is also a blood thinner, which is very beneficial for patients who have had stroke or heart diseases or heart attack. Moving on, how about the risk and precaution? Because it's also important to remember this because people with the following condition should be cautious about taking aspirin and should only do so if a doctor would recommend this medication, particularly for people having bleeding disorders such as hemophilia, uncontrolled high blood pressure, asthma, peptic or stomach ulcers, liver or kidney disease. So again, this may involve some risk and precautions. Under a doctor's supervision, people who are pregnant or breastfeeding may take low dose of aspirin. However, doctors usually do not recommend a high dose aspirin during pregnancy. Moving on, also, remember this one. Anyone with known allergy to aspirin or to any other NSAID, such as ibuprofen, should avoid this medication because there are some patients who are allergic to aspirin, also allergic to ibuprofen, any NSAID or any medications with salicylates. Okay, so remember that. Moving on about the side effects. Okay. Regarding the side effects of aspirin for the people out there watching tonight, the most common side effects are as follows. Patient may have stomach or gut irritation, indigestion, and some patient would experience nausea. These are the common side effects of aspirin. Also, okay, we have the less common side effects. Okay, the less common side effects are the following. It may worsen your asthma symptoms. Patient may have difficulty of breathing. Some may experience vomiting, stomach inflammation, stomach bleeding, and bruising. Aspirin can also have, okay, in addition, aspirin can also have very serious side effects. Okay, very serious side effects of aspirin includes bleeding in the brain or stomach, kidney failure, a rare side effect of daily low dose of aspirin, which is hemorrhagic stroke. So again, before taking this medication, you need to check the drug label because this medication, as I have mentioned in my opening statement, you can take this, you can buy this over the counter. However, you should know the side effects of this medication because the very serious side effects of this medication may lead to potential serious side effects, such as the things listed on your screen: bleeding in the brain or stomach, kidney failure, a very rare case of hemorrhagic stroke. Okay, moving on. Remember this, dear viewers, as we end this discussion. As a summary, aspirin can help prevent and treat a range of health issues, but people under 18 years old should not take it without medical guidance. You need to visit your physician. Aspirin is not safe for everyone, especially in a daily dose. Other options for mild pain relief include other NSAIDs such as ibuprofen and acetaminophen. Aspirin is available over the counter or by prescription. Always follow the instruction on the label or a doctor's advice. This is especially crucial for people who may be more likely to experience the side effects of this drug. Always remember, be safe and be healthy. Always consult your physician. So once again, this is Dr. Mike. I hope you liked our episode for tonight, all about aspirin, the uses and the side effects of aspirin. And to all the viewers and to all the followers, thank you so much for joining me tonight. Have a great Friday, everyone. Please don't forget to follow us on our Facebook page and also on our YouTube channel. Health Talk by Dr. Mike. And again, see you again in our next live episode. This is Dr. Mike. Stay healthy, stay happy, and be nice to all. Have a great evening. Bye bye.